Health and Human Services Secretary Robert F. Kennedy Jr. was here at the Capitol to meet with Governor Greg Abbott today to talk about rural health care. As CBS Austin first told you back in June, many rural hospitals are now afraid of the negative impacts of funding cuts, including 15 right here in Texas.
Our goal has to be to ensure that every corner of our state is going to be prepared to respond to the health care needs of their community, however unique they are. The rural parts of the state represent the majority of the state.
That was Governor Greg Abbott after a roundtable discussion with U.S. Health and Human Services Secretary Robert F. Kennedy Jr. about rural hospitals and the crisis of closures they have struggled with.
Rural America is in crisis, and the rural hospitals are absolutely critical for them.
Kennedy announced new funding to be directed to rural hospitals, increasing funding from Medicaid from its current $19 billion a year to $50 billion a year under the Big Beautiful Bill. Abbott told reporters the state legislature approved $300 million for rural health care and $500 million for mental health over the last two sessions. Rural hospitals have a disproportionate number of patients who are on Medicaid or uninsured and who are older and sicker. The first $25 billion will be evenly distributed among the states. The second $25 billion states will be granted based on applications. That deadline is December 1st.
This bill has the capacity to save these rural hospitals, to give them a chance to stabilize themselves, to right the ship, and then to adopt innovation and workforce changes so that they can survive for the decades into the future.
That includes infrastructure like telemedicine and more staff. They're talking about a December 1st deadline. What do you say to the pregnant woman in Fayette County right now, or the cancer patient in Llano County right now, about keeping their health care options available to them?
Well, I think the big beautiful bill, the money, that's why we want to get money out the door as quickly as possible. This is an unprecedented fast pace.
According to the Texas Organization of Rural and Community Hospitals, 20 rural hospitals closed in Texas between 2010 and 2020, and another one in the 4 years after. Reporting at the Capitol, Adelia Uchida, CBS Austin News.
Thank you for watching. Please hit the subscribe button and get the latest news by downloading the CBS Austin News app.